Welcome, everyone. I'm Dr. Eric Bunge, and this is a brief talk on supportive care for Alzheimer's, dementia, and Parkinson's disease with red light inflammation therapies. I'm a chiropractic physician and a Medicare doc. I work in South Carolina near Hilton Head and here in the Villages in Florida, and this is the Seabreeze Recreation Center. It's a wonderful place to be able to give a talk, and we're going to get right to it. So I'm going to be using my Vielight here while I do this talk because I find it important to do challenging activities while I'm using my red light therapy. This is an 810 intranasal device, and if you look at the vector, it's going right to the middle of my brain, right where all the connections are, and it's reducing the oxidative stress from today's workload. It's improving the mitochondrial dysfunction because I am 55 and getting older, and we wanted to see more energy available for our cells to repair and grow and for me to be able to think. It's also releasing nitric oxide into the vascular system. It's 55 years old, and it's helping undo some of the damage that's been done and helping those epithelial cells get oxygen and nutrients to my brain cells and the glial cells. It's also helping improve the collagen growth and helping me feel better as far as anxiety and depression. And last but not least, just helping me feel stronger, better sleep, and more concentration. So a Vielight intranasal unit, or the head units, are set to be used 25 minutes twice a day, simply sitting here and letting the unit do its work. They also have a head unit that can get the outer part of the brain, that's called the cortex, and then this unit is going deep into the ventral midbrain, and where all the connections come together, and where that ever so important substantia nigra is, and then all the parts that create memory are right in the middle, all the connections. So red light therapies might be new to many, however, they've been around for decades. I think there's 30,000 clinical articles written, whether it's research at universities or physicians, clinicians. They've produced all sorts of red light therapy. The military has okayed it. NASA is credited with discovering it. However, it's been well used by thousands and thousands. I believe there's over 15,000 of these Vielights sold in the United States alone this year. And from what I understand, very few have come back. So it must be working and must be doing something so that we can support this care and we can build on it. And I'm going to take a minute here to help you explain why it's actually working and what it's doing. So I mentioned a couple specific things. However, perhaps most important to us, and whether we're caregivers or ourselves feeling the symptoms of these terrible illnesses, it's going to help with the quality of life. Not only mood and ability to talk, and think, and carry out independently our daily activities, but we're going to see better sleep. We know from the research, and there's just so much research, it improves the cerebral blood flow. So blood's actually getting to these areas of our brain that are hurting. It's going to increase the neural connections. It's going to help with getting rid of the toxic load, and they've even seen research showing that it gets rid of that amyloid plaque. It starts loosening it up and moving it out. With Parkinson's, it's going to help signal synaptogenesis, and that's going to reverse the trend towards early cell death and that nasty and that terrible apoptosis of where our cells aren't healthy and the environment isn't healthy in our brain, and our brain just lets these nerve cells die. This early cell death, we see a decrease in that. And for dementia patients with the Vielight, in just 12 weeks, increase circulation to the brain, increase neural connections, and all their functional scores improved. And that's in mild to moderate cases. And I might want to add here right now that it's proven safe in all conditions. It's a complementary care. It's not meant to replace the medical necessity of the doctor's recommendations. This is meant to be supportive care. It's meant to complement the repair and healing may see in the future that it actually is one of the ways that we can use to prevent it from happening in the first place, especially when it comes to inflammation of the vascular system and how that prevents energy and oxygen from getting to cells, which then has a cascade of degradation and degeneration. Very important is also this is being used when there's injury. So in 12 weeks with severe to moderately severe Gulf War veterans with post-traumatic stress disorder, we saw them lower from that severe category to almost it's just a mild case. Their cognitive scores improved, their mood, less pain. With less inflammation and with this healing, we're going to see less pain. And improved sleep. So how does this process of red light inflammation therapy work? What is it doing right now and with my capillaries and my nerve cells and the glial cells and the immune cells and the platelets and the fibroblasts that build collagen, the muscles that might be around my eyes? Well, it's pretty miraculous. But decades ago, they did an experiment where they were shining this very specific frequencies of red light therapy, 635 and then the 800s and 900 nanometers. 635 is the color red, okay, and it has to be pretty close to that. But then when you get to the 800s and 900 nanometers, you can't see those with your naked eye. If I take this out, there's no red light there shining through, but it's actually actively shining right now, but we just can't see it with our eyes. Well, what they discovered is this effect called photobiomodulation, PBM. And what that means is this light energy has just enough power to do something in the chemistry of the energy system of our cells. So every cell in your body, the trillions of them, have mitochondria energy generators, okay? Except for red blood cells. And that's why we use green light, is to help the red blood cells. But the red light therapy, it helps this thing called a mitochondria. And in our body, when we eat food and carbohydrates or fats, CHO, and we add oxygen in this mitochondria, it goes through a process called the Krebs cycle, and that makes this stuff called ATP, okay? And that's what every cell process uses. When you look at chemistry, that's the catalyst, that's the actual energy source that allows it to happen. And then it turns those carbohydrates and fats into simple carbon dioxide and water. I mean, that's how clean the human energy generator really is. And this mitochondria is the key. And the problem is, as we get older, everything slows down. But because of oxidative stress from our daily lives and from the foods that we're eating and from just not getting enough sleep or working too much, or we've all been through 2020 at this point, and just imagine the stress loads, how they've increased dramatically. Well, because of this oxidative stress, things start clogging up within our cell. And one of the things that we know is this nitric oxide gets bound to part of this Krebs cycle. It's called the CCO enzyme. And that CCO can't make any more ATP because the nitric oxide is bound to it. And this is probably one of the reasons we see fatigue happen as we get older, and certainly it's the foundation of why we start degenerating. So combined with the less energy and the oxidative stress, each day our whole body is having to overcome this inadequacy. And so when we go to sleep at night, when we try to repair, if we don't have the energy to repair and we have extra oxidative stress, we start having degeneration. And this is where we start seeing the conditions appearing, that our cells can't function properly, or we start seeing joints not getting the lubrication they need and they start wearing out, muscles weakening. But more importantly, up here in the brain, okay, these nerve cells, which have not only the nerves, but they have all these things called glial cells. And glial cells are several different kinds, and they're what actually keep the nerves alive. These are needing energy and oxygen too. Well, this red light therapy has just the photon of red light in these wavelengths, very specific wavelengths. So keep in mind, this is not an infrared light, this is not a red light bulb, but these are in sunlight. You know, all these wavelengths are in sunlight. These photons of light at these frequencies have just enough energy to energize that nitric oxide and bump it off the CCO, and now now all of a sudden the Krebs cycle starts turning and we start producing this ATP. And then the miraculous benefit to red light inflammation therapies, and one of the things that sets it aside is the fact that it's able to undo this stagnation that's occurred, free up this energy, and the benefit is it also releases nitric oxide. And that nitric oxide, we all know, goes down to the capillaries in the brain and helps them open up. They now have the energy from the mitochondria function, and they have the nitric oxide signal, and everything starts moving more smoother, getting nutrients and oxygen in, getting waste and all the toxins out. So this red light therapy in these wavelengths is able to just safely bump that nitric oxide off, dissociate it, and allow this whole system to start moving. And that's why we see red light inflammation therapy working so well. And that's what sets it aside from all other therapies. And I have literally spent since 2010 researching all the therapies to what works best for my Medicare patients, what works best for my athletes, what works best for the worst of us who are getting older too fast. And this is the research that's come about. There's plenty of it out there, Vielight.com, AspenLaser.com, Fairlight.com. If you go to PubMed and put in LLLT, low-level light therapy, oh, you'll see so much stuff. It's very technical, but now you understand how it works a little bit. Light therapy releases the ATP and the nitric oxide. The nitric oxide opens up the vasculature, the ATP energy through all the different kinds of cells that are there to get everything functioning better. And in a few short weeks or months, we start seeing a dramatic improvement in the vitality of our function. So it's pretty simple, it's pretty miraculous, and there's a heck of a lot more to it, but this is the basis of it. In Hilton Head or here in the villages, I'm available for consultations. There's plenty of therapists all across the country that are familiar with advanced red light therapies, and I do recommend only the advanced red light therapies, simply because without the adequate power, without the adequate clinical knowledge of how much energy you can actually use and how fast you can use it, there's a chance you're not going to get the same benefit. To be of help further, I'm available for consultations, either here in the villages of Florida or at Hilton Head up in South Carolina. We can help you look at your particular case and say, how much recovery energy are you currently able to utilize? Some of us just are so beat down, think about diabetes and Parkinson's and chronic inflammation, that we need to bring them up more slowly. If you're not able to get a consultation, I recommend you immediately go online, pick yourself up. I would recommend the Juvie, the Gamma unit, also the 810 intranasal unit. There is a promo code, Bunge 2020. I like to say a vote for light is a vote for health. So if you use that promo code, they'll give you 10% off. And they have a great return policy. Within 6 months, if you're not real happy, they'll refund 80% of your money. So you get to use this for next to nothing for 6 months to see the benefits. But you'll have benefits. I've used this every day since 2014. There's benefits, and they're there, and I do want to hear about them. So please feel free to research it on your own. If you need to contact us, give us a contact, and we'll be glad to reach out and help you. And for those who I get to meet in person, I thank you. It's an honor to be of help, especially in the most serious of cases. And to the rest of us, let's have a safe holiday season. The end of 2020 is going out with a rough one, and if you're having trouble with your immune system, red light therapy is an instant boost. Thank you.